To help us separate fact from fiction when it comes to these drugs, I'm now joined by Dr. Anahita Dua, vascular surgeon and founder and chair of Healthcare for Action. Doc, welcome to the show. Everyone knows someone that is on these drugs. So these medications have 4 mechanisms of action. I'm just going to read it for our viewers. Stimulating insulin release, reducing blood sugar, slowing digestion, and ultimately reducing hunger. How do these 4 actions protect people from more than diabetes, but like I mentioned, cancer, even sleep apnea?
Well, they're all connected to basically weight loss and inflammation. So the 4 mechanisms of action that you mentioned really come together to ultimately help patients reduce that weight, get off some of that adipose tissue or fat, and in turn decrease some of that inflammatory response overall in a person that can lead to things like heart attack, like stroke. And so that's really what we are seeing. It's not the drug itself that's magic, it's what it's doing to the person that then allows them to have reduced issues that otherwise could kill them.
I mentioned that study that pointed out many people cut back on physical activity when they start GLP-1 drugs for obesity because they're losing the weight without much physical activity. So what kind of workouts or activity should you be doing if you're on these medications?
Well, there's really 2 things that you should be doing on these medications. One is that you really need to be doing something to build muscle strength. So a lot of like weight training versus the cardio specifically. And the reason for that is because when you start the drug, there is sometimes a loss of lean muscle mass. So you need to be eating properly, which is part 1, protein intake, in conjunction with ensuring that you're doing that weight training. Otherwise, you will lose the muscle mass. And then it can lead to things like Ozempic face, which people talk about sometimes, where people just look a bit haggard because they're losing some of that muscle.
How can people ensure that they aren't losing muscle? It's proper diet and weight training.
Exactly.
Ultimately.
I mean, it's a little bit counterintuitive because really, if you talk to a doctor specifically about being on these meds, they will tell you that you need to be taking in sometimes even higher calories, but in the protein space. And so it really may seem, well, that doesn't make sense because at the same time I'm taking a drug that's stopping me from eating. But then you should up the level of protein by potentially even taking something like a protein shake in conjunction with that weight training to ensure that you do not lose that muscle.
Nearly 70% of people who stop taking these medications regain most of the weight they lost within 18 months. But researchers believed, and I just found out about this as I was researching this story, they've developed a minimally invasive procedure to help keep the weight off. The procedure, for our viewers, uses controlled heat to renew the lining of the upper small intestine, potentially resetting a person's metabolism. Yes, it sounds magical, but do you believe this is going to work?
Well, right now the study is promising. About 45 patients were in that study, but they have not yet done a randomized control study properly with the right power of patients. Basically, the way that it works is once you have a high-fat diet, high-sugar diet, the inner lining of your gut just past your stomach can get a little bit too thick. And what's going on with the doctors is they can, under a little anesthetic procedure, go in and burn the inner lining of that stomach area, resetting the whole area. It's a little bit like a quote-unquote chemical peel for your face to reset it, but not exactly the same thing. You know, I just want to be very clear, but kind of the same concept. But again, we do need to ensure with the science that it actually works. Otherwise, you're taking all the risk and not getting the benefit.
Doctor, when patients come into your office and they're on these medications, what do you see them do wrong? We know how this goes right, but what are they doing wrong?
I think the biggest thing is twofold. Number one, what you already brought up about them saying, look, this is magic. I'm going to take the shot once a week, and then I don't have to do anything. I can eat what I want. I can not work out. That is wrong, because what it will do is put your body into starvation mode, and you can end up having a lot of issues. The second thing is, you mentioned a significant proportion of the United States is on these drugs, and a significant proportion of them have not actually been prescribed. They are getting compounded medications from like med spas, which is fine to do if you want to lose a little weight, but make sure it's a good place, because you don't want to get drugs that are not FDA approved and get yourself into a situation that can be very dangerous.
This is very informative, very important in our time. Dr. Dua, thank you so much for coming on.
Thank you.
Let's switch.